From the American Neurological Association, I'm the ANA's outgoing president, Frances Jensen. I'm sitting in for Adeline Goss, and this is a special episode of ANA Investigates. We're here at the meeting on the last day of a wonderful multi-day meeting, which is the 148th meeting of the American Neurological Association. We've had a very refreshed feeling after this meeting where we've learned a lot of the cutting-edge issues in neurology with respect to education, research, and clinical matters. With me to talk about highlights from the meeting is Rebecca Gottesman, Stroke Branch Chief of the National Institute of Neurological Disorders and Stroke, and outgoing chair of the annual meeting planning committee. And I have to say, before I even welcome you, Rebecca, that you have been amazing at putting together a fantastic program for the last 2 years. We've been partners during my 2-year run as president. So welcome, Rebecca.
Thank you, Frances. Thanks for having me. And I do have to point out that this is very much a team effort. There's been a lot of people that have been putting a lot of hard work into what I agree has been really a terrific meeting.
So let's just get right to it. Rebecca, when you put together a program for this year's meeting, what were some of the key areas you really wanted to highlight, and how did you go about it?
So the process of coming up with the meeting, I think, is great in that it's really a chance for people who are members of the organization to tell us what they want to hear about, as well as we have an annual meeting programming committee that then looks at those ideas and decides really what would be ready to present in a plenary session, what would be ready to present in an interactive lunch workshop, or in a special interest group, for example. We also have great professional development courses as well. And so a lot of the balance is thinking about what is the most exciting science, but that's ready to be presented in this format. So there might be some really new, exciting stuff that we think needs another year before it's ready to be presented in this format. And I actually think that what we're seeing is the science that's being presented, in my opinion, is the closest to being translatable than we've seen for quite some time. So in the past, we've had phenomenal scientific presentations and understanding quite a bit about basic mechanisms and realizing that that might be 5 steps away from translation into therapeutics, for example. But now that there have been a number of therapeutic advances in the field, and particularly I'll sort of mention gene therapy is one area where I feel like we heard a lot, not only of successes, which we know have been around over the past few years, but advances and modifications to improve treatment, to improve opportunities for therapeutics.
Yes, and I'm glad you mentioned that, Rebecca, as an example, because I think gene therapy is really emerging onto the scene in the neurosciences in general. And we are one of the fields in medicine that are most ready to apply gene therapy, given the enormous number of neuropsychiatric conditions that are, in fact, linked to genetic mutations. And we are sort of second to hematology and oncology, but possibly eclipsing them in this next decade with some very promising areas. And I think that we heard a little bit about mRNA technology, different ways to introduce genes into the neuraxis that are really cross-cutting and really at the cutting edge. But we're also listening to current experiences of what are some of the downsides, what are some of the risks of gene therapy that I think were very practical, because many departments right now are setting up gene therapy centers. So I really liked the way that the program in different ways covered this, between some conversations in the special interest group and also in that plenary. I think that because we have an audience of young trainees that are entering this field, it's an opportunity to inform them of the options we have, especially in these areas where we know we need an increased workforce, and also for some of the leaders, like best practices that they can share amongst each other. Let's talk about a few other of the cutting edge research areas that emerged at the meeting. Rebecca, why don't you mention a few others, and I have another couple, I'm sure, to add.
Absolutely. I'm sure you have some ideas of what was most exciting. So, and again, the gene therapy that we already talked about was not only mentioned in sessions that were explicitly dedicated to gene therapy, but I feel like it's appeared in almost every session, at least the plenary sessions. The other theme that I've seen consistently come up is that of biomarkers. So certainly biomarkers have been of interest for a long time. And we know that in neurodegeneration and Alzheimer's disease, there's been a shift in general to interest in blood-based biomarkers, which I think has been very exciting in the field. We certainly heard a bit about biomarkers in the context of prodromal neurologic disease in a plenary session that we had yesterday. That was on the Monday of the meeting. And in addition, biomarkers, I think, are going to play a role in our final plenary session this morning, which is on anti-amyloid therapies, which is another example of how we're not going to only learn about the science and the advances in the science, but the very practical issues about how to actually implement new therapies, how to get them to people, how to get them to diverse communities. And I think that that's really important, both in motivating these future junior leaders, as you mentioned, in realizing that there's excitement in the field and there's things that still have to be done, but also really giving both useful scientific as well as practical information. So biomarkers, I think, is something we're going to continue to hear a lot about.
Yes, the biomarker issue is, we are at a point now that we've done it. There's been enough research in the basic mechanisms of these diseases and advances in genomics on the clinical side and imaging and plasma assays that we're at this amazing point where we're able to now track stages of disease. And of course, it's an emerging science, but these biomarkers are going to be very important, not just for the treatment, identifying people in a prodromal stage, for instance, that are at risk for subsequent progression, but also for clinical trials. If we don't get the right stratified patient populations for clinical trials, for treatments or device trials, we are going to be really held back because, of course, early in the stage of any disease, you might have very different therapeutic targets than later. And if we don't identify those, it's going to really impede our ability to do the clinical research that we need to do in this next couple of decades. So I really am glad that you brought up biomarkers. You ran a wonderful presidential symposium and you opened the session pointing out that it would be really powerful if we had a biomarker for sleep disturbances that could really help us understand the role that sleep has in brain health. So I thought that was a wonderful session, both telling us about the cutting edge basic science work, as well as how it applies to disease in adults and children. Now, with respect to sleep, we, as you know, in the presidential plenaries, what we try to do is pick something that, needs to be reviewed and reassessed by our field, or sometimes it is a brand new topic that is so important to our field. In this case, sleep, we feel it has been underappreciated as a factor in many disease processes. And since we spend a third of our time doing it, our brains spend a third of the time in sleep, I felt that it would be really important to bring back to our wonderful audience here at this meeting a few reflections on what has been happening in sleep research in the last decade or so, and even in the last 1 to 2 years. I think that sleep research has generally been in a neurology department, but because of its alliance with the pulmonary field, it's sort of been a little bit more at the periphery. And I think, neurology needs to own sleep again. It is really our disease set, our brain state set that we need to study. It turns out that sleep can be used as a biomarker. Sleep disturbances can often precede the onset of many disorders. We heard yesterday in a beautiful symposium in the prodromal session which wasn't even in our session, that REM sleep disorder actually precedes Parkinson's onset by multiple years. We know that it can be a warning sign for prognosis in things like TBI, even epilepsy, and also dementia. But on the flip side, sleep deprivation can aggravate many diseases. And what we heard about in the plenary was the interaction between sleep and dementia, in that David Holtzman presented a beautiful presentation on how A-beta tau levels are increased with sleep deprivation in experimental and clinical samples, and how we have to think about sleep as almost a mitigatable therapeutic target, if you will. We actually also heard about the neurobiology of sleep from Maiken Nedergaard from University of Rochester and University of Copenhagen. She has some groundbreaking research which has been building for the last few years on something called the glymphatic system, which is a system in which it's like a lymph system for the brain, which is sort of a convectional clearance of toxins that end up in the venous system through kind of a lymph-like pathway, and it only happens during deep sleep. So if you don't get good sleep, you're not removing the toxins from your brain, and it might add to the progression of diseases. She's shown a link to dementia, for instance, that in dementia there is less clearance, and that might be contributing to the accumulation of abnormal proteins in the brain. So we're just touching the surface. And imagine, we know there's an interaction with TBI, epilepsy, even MS with sleep deprivation, and not to mention the psychiatric disorders. So I think we're on to a really important era in sleep research, and that was the reason why we brought it up. One last part of it was genomics. Apparently, there are people that are natural short sleepers and they do great, and people who are long sleepers. And there's a whole genetic biology of actually circadian biology that's regulating on an individual basis what your sleep should be. And also across the lifespan, you need, varying degrees of sleep across the lifespan. And Louis Ptasek, who was the lead speaker, suggested that sleep should be a vital sign when you actually interview your patients, just as much as you care about their blood pressure, hypertension, like how are you sleeping? So I thought that was really clever too. And as I said, we need a biomarker. What is that feeling of refreshed sleep? And can we have a troponin for good sleep, troponin level? We need that. And I think this looks like it's very promising, especially with the glymphatics work, that we might be able to find something like that in the plasma that would tell you had a refreshed good sleep or not. I was very excited to present that. Another quick thing I would mention that we have interactive lunch workshops, which are like hour plus sessions on lots of different topics. And one that I just really like to quickly highlight, the Global Engagement Committee put on an interactive lunch workshop. And this has been a presidential initiative of mine to reach out and create a global, mutually beneficial collaboration with some lower and middle income countries. And we picked for a target for these last 2 years, sub-Saharan African countries. And we've been able to give pilot grants to physicians in Uganda, Nigeria, Ghana, and Zambia. This is culmination of a multiple webinars during the year and an in-person meeting last year. We had some of our visitors come back and present their work. And I do believe that one of the responsibilities of those of us in U.S. academic neurology, since we are closer to sort of the cutting edge discoveries, to make sure that our global partners have access to the same kind of research tools and opportunities to think about treatments of populations that might have disparate care. So it was an outstanding session run by Kiran Thakur, who's our chair of the Global Engagement Committee. So I think we've covered a lot. One last thing, Rebecca, how is the new member meet and greet before we finish and go off to the meeting?
It was a great time. Certainly this meeting, I think as everyone knows who's been there, is all about certainly the science and certainly hearing about the advances. But my experience and that of many people I've spoken to is that this is the best place to network and to meet future trainees. It was really wonderful to hear from people who felt that this was going to be their first of many. And actually even nicer in some ways, I met a number of people who said last year was their first year and they loved it and they're not presenting this year, but they wanted to come back because it's really now their favorite meeting. So I think that says a lot about the organization, the way that people interact with each other. And certainly those receptions and opportunities to meet some of those new members are really a wonderful way to do that. So certainly was a nice event.
It was. And I think we're seeing more and more younger people involved in the ANA. And as I've been saying during my speeches throughout the meeting, that one of the things we as academic neurology leaders have to be concerned about is that there is a huge demand for neurologists, both clinical, physician scientists, educators, and that we need to bring more people into the field. And we have to steward the future of our field because we are going to be so necessary to help the healthcare systems and to biomedicine moving forward. In stewarding the future, we need to nurture and bring in young people and encourage them to stay in our field. So we're very excited that we have had such a great turnout. Thank you, Rebecca, for joining us.
Thank you so much for having me.
That was Rebecca Gottesman of the NINDS, who is the outgoing chair of the annual meeting program committee. And I'm Frances Jensen, chair of neurology at the University of Pennsylvania, Perelman School of Medicine, and outgoing president of the ANA. And ANA Investigates is the official podcast of the American Neurological Association. The show's producers are members of the ANA Education Innovation Committee, chaired by Megan Ritchie. Our program was produced today by Adeline Goss, Caitlin White, and Megan Ritchie with the help of Jen Hurley. Adeline Goss is the show's executive producer, and you can listen to past episodes of the show, subscribe to the podcast, and access all of the ANA's educational programs on the Education tab at myana.org. That's it for ANA Investigates. Dr. Goss will be back as your host next month.